interrogation room?
Yeah, pretty much. Okay, so what we want to do first, we're going to talk about seated treatments, especially on a stool or in a chair. This chair has a back, it's obscured because there's a person in front of it, but this would be the chair that would, or a type of chair. If a chair has a back, it provides the most contact for a patient. So there's more safety, but there's less movement. There's more things in the way of movement. So if I wanted you to rotate, just try to twist this way. It doesn't work very well, right? So one of the things that we can do in a situation like that, so I'm just going to have you sit and face that way, right? So now we're free to rotate back to the right. It's quite free, so I have to switch the orientation. And then if you twist to the left, the problem is that the chair starts to get in the way, the back of the chair. Now you can't see that from the angle, okay? So as far as, now if I make you face forwards again, okay, and side bending is fine. So side bend this way, no problem. Side bend the other way, it's okay. But you do end up with some challenges. So you get more control out of a chair with a back. Now, if a chair has armrests on it, you also have something else in the way, but you also have something that the patient can hold on to generate some of the movement, right? So if you stand up, I'm going to get this out of the way, and we're going to give you a stool, right? So a rolling stool. Sit on that, please. So now we have freedom no matter what, right? So twist this way, no problem, but that's going to roll, right? So we have more freedom of movement, but because there's more mobility in the actual surface the patient is sitting on, it becomes more of a control thing for me. I end up having to generate more control. So if I wanted you to rotate to the right, I have to block your legs. Right now, the problem becomes simply, I'm standing in an awkward spot. She might end up hitting me in sensitive areas, which is not the most comfortable. And then for me to grab her here, not comfortable. I'm going to pull her face right into my chest. Now, if I'm back here, give yourself a hug, right? I can use my thigh here, and I can start to generate the rotation, right? So I can reposition myself, and now I can do things like what I want you to do is I want you to walk your feet over to the left, right? So now I can use the stool to end up gaining more rotational force, right? So there's more freedom of movement because there's no back. There's more freedom of movement because the actual seat or stool will move, but there's more control requirements of me, and I need to consider where I'm going to position myself so that I'm not generating any sensitive issues or issues where the patient feels somewhat uncomfortable or anything like that. We want to be as respectful as we can. So I'm going to have you stand up off that. Try to get this out of the way. And then this is lower, but it doesn't have a back and it doesn't move. So, you know,
and it might break.
No, it's not going to break. Okay, so side bend towards me, side bend away from me, right? Twist, right? So the twisting is free. I don't have the same control requirements because the stool itself won't move. So we consider different types of seats, different types of chairs for they all give us pros and cons. For the most part, most practitioners are probably going to be working with a rolling stool in their treatment space. So most of what we'll try to show here really quickly as videos go on is manners in which you can use that rolling stool. But it's going to be important that you understand that the chair with a back takes away control requirements from you, but requires you to move the person around. If a chair has arms on it, you can't turn the patient to different orientations with the seat. It becomes a problem.